Hey there, healthcare professionals, politicians, or public health decision makers. Today, I want to introduce you to a revolutionary tool that is transforming patient care as we know it. Meet Dr. Maya's app, a game changer developed by Dr. Kadiyali Srivatsa. Before tech giants began offering online medical advice and consultations, Dr. Srivatsa had already envisioned a unique, patient-centered approach. Dr. Maya's app uses an innovative, unique, color-coded symptom system to guide users in assessing their symptoms and deciding the best course of action. This approach not only minimizes unnecessary clinic visits, but also reduces the risk of cross-infections, prevents epidemics and pandemics, and saves money and lives. So, how does it work? Let's dive into the color codes. First up, we have red. Red signifies symptoms that require consultation exclusively with a doctor. It's not just for emergencies, but also for symptoms that need a professional's judgment, empowering patients by clarifying the severity of their condition. This reduces anxiety by distinguishing between needing a doctor's expertise and an actual emergency. Next is blue. Blue flags symptoms potentially related to infections. If a user has multiple blue symptoms, the app advises seeking emergency services and isolating to prevent infection spread. With fewer blue symptoms, a doctor's phone consultation prevents the user from traveling to hospitals and clinics to protect healthcare workers and other patients. This approach encourages patients to act responsibly, protecting themselves and their community. Then we have green. Green indicates symptoms that do not need a doctor, but can be managed by a nurse or trained healthcare advocates using a protocol or guidelines. If users have 3 or 2 green symptoms and 1 yellow, they are advised to consult a nurse or call NHS 111. This tiered care system allows patients to address mild symptoms with accessible support, easing demand and the cost of providing comprehensive healthcare to citizens in developing nations. It also helps alert public health officials when clusters of spreading infection are identified. And finally, yellow is designed for minor symptoms that users can often manage on their own or with the advice of a chemist. It encourages self-care, giving patients the confidence to handle non-serious symptoms without a clinic visit. This empowers patients and conserves healthcare resources for those with more pressing needs. By focusing on a 3-symptom combination approach, Dr. Maya's app mirrors doctors' diagnostic processes. It does not follow an algorithm pattern, so it is very simple to follow and safe. It doesn't draw conclusions from a single symptom, but considers patterns, improving decision accuracy and supporting responsible healthcare behaviors. The goal of this unique innovation, Dr. Maya's GPT, is to shift the mindset towards proactive health management, self-assessment, and reduced clinic dependency. This is especially beneficial in regions where healthcare resources are limited. The app encourages informed decision-making, safeguards community health through isolation guidelines, and ultimately empowers patients to manage their health confidently. Dr. Maya GPT also prevents politicians from concealing the truth about epidemics and emerging infections to help us prevent pandemics. In a world where healthcare demands are constantly evolving, antimicrobial resistant infections are threatening our very existence, and emerging infections are threatening our very existence. Dr. Maya's app stands out as a beacon of innovation and patient empowerment. So, if you want to enhance patient care and make a real difference, Dr. Maya's app is the only tool you need. Please scan the QR code, read The Art of Self-Diagnosis, and be prepared when the tsunami of infections, which is 20 times worse than COVID-19, starts spreading. Follow, share, and please comment. Thanks for watching and stay healthy.